Chuck Yost, Assistant Chief, Wildlife Division, to discuss chronic wasting disease.
Should I move to another chair?
Good afternoon, Commissioners. It's a pleasure, as always, to be before you today. We'll talk some more about chronic wasting disease as a follow-up to the May presentation where you heard about our chronic wasting disease response plan in case of a detection in our state. Before I begin, I should make several acknowledgments, if you'll reference the slide there. These days, a whole lot of folks work hard on developing these types of presentations. So I want to take just a minute and acknowledge these contributors to this presentation. Specifically, Lynn Barrett, who is one of our GIS professionals who put a lot of work into this, and James Kelly, who's on the front row there. James, if you'll wave. James is the new Deer Program Leader and had a lot to do with this content as well. So you'll learn more about James and get a more formal introduction tomorrow from Chief Goodland, but I wanted to mention him specifically as well. So a lot of folks contributed to this, even folks from across the nation, so it's good stuff. So over the next few minutes, I'll provide an update on coordination with the Tennessee Department of Agriculture. I want to identify the greatest risk factor in spreading CWD and discuss cumulative risk of chronic wasting disease, and then review the regulation for importation of wildlife carcasses, identify and explore some options for carcass importation guidelines, and then allow the opportunity or sort of pause and let you guys take the appropriate action as you see necessary. Real quick, an update on coordination with the Tennessee Department of Agriculture. Since we met last time, we've been in several meetings with them, and some of the results of those meetings is that they have firmed up their response plan if there was to be a CWD positive deer or elk found in a captive facility in Tennessee. If you'll remember from the last presentation that that authority lies with the Tennessee Department of Agriculture as opposed to TWRA. And we've been working or going to continue to work even more cooperatively on increasing sampling of deer or elk on wildlife preserves. And then finally, developing a cooperative program concept that hopefully will help raise awareness of CWD in Tennessee, increase sampling for the disease, and then improve carcass disposal practices in our state. So that's a recap or an update on those discussions. I want to remind you that captive deer and elk are our greatest risk factor in spreading CWD. And you see a visual here of the locations of those facilities in our state. And I just want to remind you that the movement of those animals poses the greatest risk for this disease being in Tennessee. But there are other risk factors. And our friends in Arkansas explained to me that there are cumulative risk from all of the different types of risk as it relates to CWD. You know, not only do you have the risk posed by captive cervids, but you also have the risk that comes from carcasses being improperly disposed of or maybe being brought from positive areas into Tennessee. And then you have other types of risks, like, for example, deer urine-based attractants, the fact that those could contain the infectious prions that could then be brought in or used in Tennessee and brought in and compromising our deer and elk. So even if it seems like a small risk, the combination of all the risk is a big deal. So more than likely you're aware, but just to remind you, we currently have this rule that is, I refer to it as the carcass importation regulation. And in that rule, it says that if cervid carcasses, cervids being deer and elk. If those carcasses are brought into our state from areas that are known to have chronic wasting disease, then they must meet certain criteria, like, for example, the carcasses must be deboned before brought into Tennessee. And that annually, the commission and the agency will compile a list of these areas so that hunters know where these requirements exist. I want to show you now that these are the areas nearby or nearest Tennessee, the red areas, where chronic wasting disease is known to exist. So these are the areas that we know the disease occurs here. But I also want to tell you that as recent as 2015, Arkansas didn't have any red areas. So it's real important to realize that just because areas aren't in red doesn't mean that the disease doesn't occur there. So we just have to be sure that we're mindful of that. This is where we currently are, and this is the map that you'll find on our website that delineates the areas in yellow that you would be required to meet the guidelines in order to bring deer or elk into Tennessee from these areas. And it's kind of a long story how we got here, but we're inconsistent currently in how we address states. As you can see, obviously, several states, the guidelines would apply to the whole state, but in other states, it's sort of piecemeal, and it's just based on the counties that we know are positive. And what happened, to make a long story short, is that when Illinois became positive, it changed our approach. And since then, we've kind of gone back and forth. But this is where we currently are. And I think it's very, very good that we're here today to review where we are and decide on what's the best approach in the future. Now, there are several options, and I'll outline these options as A, B, C, and D. And I want to tell you that option D that I'm going to present to you here is not in your notebook, okay? That's because I realized last minute or decided last minute that should be included because that is an option that has been discussed at some level within the Wildlife Agency. And in option A, and I want to point out right offhand that this would require a rule change, and I don't think that we're necessarily even having that discussion, but I do want to point that out before I move further. And as I present these option A, B, C, and D, I'm presenting them in the order from most restrictive to least restrictive, almost, because option D is a little peculiar, but we'll explore that later. But this is where 10 states currently are. They require that these guidelines be met. From deer, elk being brought into their state from anywhere. Now, the pros of this method is that it's the most comprehensive option, but the cons, and these are ones that I came up with myself, they would require, the cons are it would require rule change and could be seen as overburdensome. And within TWA, there's concerns over the legality or the constitutionality of imposing these restrictions in non-positive states. So just to let you know, that's kind of the pros and cons of this option. And I'll point out that here's a comprehensive view of what different states are doing. And it's a little tough to digest because you got a lot of greens and yellows here that are similar in color. But I want to help you, I just want to outline in red. You'll see the states in red there. They're dark green, and then they've got a red area or red circle. And those indicate states that have the all states restrictions. So that's what it looks like nationally, and I'll remind you that 10 states are currently doing that. But that is not the agency recommendation. This is the agency recommendation, which is option B. And what this would mean would be these guidelines would be required for the entire state for positive states. And the pros of this option is that it would bring some consistency back, improve the enforceability of the regulation, and it doesn't create an exception in positive states. In other words, if it's from a positive state, they would have to meet that criteria. It's not ambiguous, it's easily interpreted, and it doesn't impact non-positive states like option A would. And then the remaining options, including this one that you'll hear about, do not require a rule change or a new rule or anything like that. So the cons of this is it doesn't require anything from non-positive states, which, you know, there's some level of risk there, because I'll remind you, Arkansas, we didn't even know it existed in 2015, and now we know it's a big problem there. Another con relates to the fact that Tennessee residents who take day trips hunting into positive border states would have to meet these requirements. So that would be a con of this option, but that is in fact the agency recommendation. Option C is, and this is one that's been discussed quite a bit internally, is that it would apply to positive states, but border states are county specific. And the pros of this option, option C, is it brings back some consistency and could be perceived as not being overburdensome to hunters hunting in positive border states. But some cons is that positive border states are our greatest threat. And it could be that we're inviting whole carcasses in from positive states into Tennessee. And another little intricate thing to realize is that if you take Kansas, for example, you know, there are some counties in Kansas and in all these other states that they may have never found a positive there, okay, in that county. However, under this criteria, we would require that no matter what county it came from in Kansas, that it would have to meet these guidelines. However, if you jumped across to Missouri and did the very same thing, you would not require it. So there's some inconsistency there, but there's also this accountability is not the right word, but there's this, we're considerate of the fact that a lot of hunting occurs in our border states as opposed to non-bordering states. Now, take a look at this, and we may have to, if you can't see this that well, see me following the presentation, I'll share this with you in more detail. But this is an image that shows the Virginia deer harvest by Tennessee residents. So where you see a dot, that's where a Tennessee hunter lives who travels and hunts and has killed deer in Virginia. Okay, so this shows that there's great potential for deer and elk to be brought into Tennessee from a positive state. And this is the case for Virginia, and this is just one state's data. It would be even better to know how this looked if you overlaid Missouri and Arkansas as well, but unfortunately we didn't have that data to present to you today. But that's a pretty telling graphic. So I guess the take-home message is that it's high risk bordering a positive state. Now, option D, which is not in your packet, that I'll share with you, is internally we've discussed what about a buffer option in border states. And this is what you have here. So we started off with this idea of what about if we had a 100-mile buffer? What would that look like? So as you look at this, it appears nice and clean, but unfortunately it's not. And we need to break it down and see what the challenges are with this option. And keep in mind that the restrictions or the guidelines would apply to the entire state in positive non-bordering states. So much like the previous options, if it's a positive state and it doesn't border Tennessee, then the requirements would still exist in those states. But in border states, the requirement will exist only outside the buffer. So there wouldn't be that requirement within that buffer. Now, as we break this down, obviously this is Tennessee and a reminder of where CWD is currently known to exist. If you take a 100-mile buffer and show that, that's what it looks like. But if you apply that only to the positive states, this is what you have. So this is what we begin to look at these states and see what would this option look like. So then we try to decide, okay, do we look at county delineations, or do we look at significant landmarks to determine what would be the best way to signify roughly where 100 miles is? So we begin to look at this, and if you look at this graphic, the county scenario doesn't work out that well, because you're dividing several counties along that buffer. It would just be hard to understand this and communicate this, I'm afraid. So I would say this would be a con of this method. But you can take another approach and look at landmarks, or say state highways or significant roads, to try to make this work. And it begins to look better. If you look in Missouri, you could use the State Highway 67, and then in Virginia, it doesn't look that bad. You use 220 and 60. But in Arkansas, it looks okay, but you got a lot of roads there that you're going to have to articulate are the boundaries, and it'd just be tough to communicate that. But it's really the best you can do, considering where the main roads are. This map shows where the main roads are in relation to what we selected as probably being the most convenient landmark. But when you clean it up the best you can, this is what you have in the end. And it looks good here on this graphic, but I think we've got a great challenge here with communicating this option. So in summary, I've put all these options together on a graphic, and I'll leave this here and pause to give you the opportunity to take action or ask questions, whichever you'd rather do at this time. But just real quick to tell you what we have here. On the far left column, that is the different options that are listed, A, B, C, and D. And then kind of a evaluation of what the different values or qualifiers, or an evaluation of what these look like. So first off, I asked myself, are they consistent or not? Are they easy to understand? What would the level of hunter burden be? How enforceable would they be? And then how much actual risk reduction would they accomplish? And again, I'll remind you that option A requires a rule change, and that internally there's concerns about that type of regulation being challenged. And then I'll remind you that option B is the agency recommendation and what was shared back in May with this body. And option D, another peculiarity about it is if those states do find a positive within that 100-mile buffer, then what? And I think that scenario would require this commission to revisit this again in a similar fashion to today. So I just make sure you realize that as well. Where the other options, I don't expect that would be the case. And I'll pause there. Thank you.
Question? Chuck, could you go back to the slide that showed the map of Virginia, where the deer were taken, the hunters taking deer from Virginia?
There we go.
Okay, it'd be nice to know where those people that live in Tennessee took their deer, and I bet you it was well within the 100-mile range. I bet 99% of them were. And if you look where I live, which is in Bristol, and you see it's solid blue or gray or whatever that is, those are the folks that I've been talking about that have property in Southwest Virginia and hunt both sides of the state, and that's where the hardship is. And then also the people that have businesses on the Tennessee side that would not be able to take. And that's a great slide, but it'd even be better if it then showed where those deer were harvested from. I mean, I know I'm the one that's been the opponent on the commission as far as wanting to shut down entire states. When you consider where Virginia is, it's 350 miles from the Bristol border, and I understand, where we're, and I'm not gonna jump up and down and scream like we did in the telephone meeting in June, but I will say that when you were talking about there's little increments of chance, and as far as I can find out, there may be 1 or 2 cases of proven carcass importation that has caused the spread of it. The main cause is from moving live cervids, and I know this commission does not have the ability to control that, but is there any chance, in your opinion, that the importation of live cervids can be, put a moratorium on that with our high fence enclosures that we have in Tennessee? I mean, if we're gonna try to slow down CWD, the easiest thing to do is just say, okay, no more importation of carcasses. But if that's such a small, minuscule amount of where the spread is occurring, are we really thinking outside the box that we're actually trying to deter CWD? I mean, I just don't want it to be, we're the only state in the country. We got 9 states surrounding us. Right now, we got 3 states, and the closest is, what's Arkansas, 225 miles maybe? The closest CWD. In the state of Virginia, it's 350 miles, and in 4 years, there's not been any movement of CWD out of those 4 states. So Virginia's obviously doing something right. And I'm just saying, I just don't want a knee-jerk reaction to shut these states down, and then the first time we have 1 positive case in Kentucky, now we're going to shut down 500 miles of borders across the northern state of Tennessee, and how that's going to affect people that own property on both sides and all. I'm all for taking care of the herd, but I'm also trying to do it in a systematic manner and that we've well thought it out. And, you know, you mentioned earlier something about, I wrote it down, you mentioned about developing a cooperative program concept with the Department of Ag. Can you touch on that just a little bit more?
Sure, and there's quite a bit there in your comments, so if there's something that I don't think to address, follow up with me.
I probably won't remember it either. But
Okay. The first thing was regarding this graphic and these results. Yeah, I would agree with you. In my professional opinion, chances are the majority of these hunters that harvested in Virginia probably did it within a close proximity to our border.
in my opinion, if we didn't have the problem that just brought up in Arkansas, we wouldn't be having this discussion today. We'd still be feeling comfortable with Missouri and Virginia. Don't you agree?
Well, I would say that, I'd say we're due to have this conversation and to you know, explore are we currently taking the best approach? And I agree that Arkansas has accelerated that, but rightfully so. But back to this. So I would say you're right on track. However, I don't have the data to show it for sure. James tried as hard as he possibly could to pull that off and show that as well, but unfortunately we don't have that for you today. Another point or question I picked up on in your comments was that, as I stated earlier, that the movement of captive cervids are the greatest risk. However, the carcass importation is a big risk. To impact the previous one, the moratorium, as you referred to it, that's a big question, and one that would, you know, something like that would require legislative changes that you know, would have to be explored by others. But otherwise, anyway, just to make that clear. So there's that component of it, and in regard to the carcasses, well, maybe that thought will come back to me and escape me. But specifically about the program, the potential program that has kind of been brainstormed by us in the Department of Ag, it really has 2 components. It has, well, I'd say they're separate. Maybe I should say they would be separate programs if they were to be implemented. But the first one is purely an idea that maybe we could develop an incentive program to increase in-state sampling. And this has been done in New York through participating, or you might call them certified taxidermists. And we've wondered if something like this could be accomplished in Tennessee and maybe involve meat processors as well. And maybe if we go really outside the box, maybe licensed veterinarians. But what we would hope to accomplish with that would not only be increased sampling in the state, but also to use that as a mechanism to train more people or educate more people on the seriousness the seriousness of the disease or the threat of the disease, and then to collect more samples, obviously, but hopefully incentivize or encourage others to use better disposal methods. You know, the taxidermist and meat processor, they're going to be responsible for a lot of disposal, and if we're doing all we can to minimize the impact of this disease or prevent it, we want to help them do that well. So, but that's purely an idea at this point, and there is so much work to be done just to decide if that's even a possibility. The second is also a big idea that requires a lot of vetting and serious thought, but if through a TWA regulation or a Department of Ag regulation there was an expectation for hunters from non-positive areas that come and bring animals into our state or deer and elk into our state, that they be required to test, that would be of value as well, because we would have the awareness of if somebody disposed of a positive deer or elk in our state, we'd know that it happened, where currently we would not.
And where it came from.
And then we could focus, sampling in those areas. So anyway, it's a whole lot of work to be done there. Don't even know if they're possible, and not sure if they would be accomplished by us or the Department of Ag at this point. But it is something that we are interested in seeing if we can accomplish something like this and working together to do so.
Well, explain to me on states like South Carolina and North Carolina, or do they even test for CWD? I mean, in our situation, we're checking all our deer in by phone, so our deer aren't really being tested. What other data do the other states have? And I'm not arguing with you. I'm just saying, I just want to get a grasp on if we're just saying you can't bring a carcass into our state, okay, but we don't really know on these states like North Carolina, South Carolina, all the ones that are around us, there's 9 states around us, and we're only talking about 3. How do we not know the other states are not CWD positive, and they don't even know it themselves if they're not collecting data? Mississippi doesn't check in deer. Alabama doesn't check in deer. To me, if you want a program that determines if we're going to test for CWD so we can know where it's coming from, the program you just talked about is one of the most effective ways, because we're testing every deer that comes in the state that goes to a taxidermist or a meat processor. We're then doing a test, and we know they got that deer from Sumter County, South Carolina. It's positive. And we can get on the phone and call South Carolina. You've got CWD. We've got proof of it here. Then we know which states to close down or which counties. How we're doing. In my opinion is, I'd like to see us try to develop that and keep the counties closed like we've been talking, or do the 100-mile zone. I'm for that too. But I'm saying leave it to where we create a program that's a little bit outside the box that other states are doing, and let's get some testing going from every state that we have deer coming from the outside. It's kind of what I talked about on the phone in June, but I just don't think with the relationship of all being on the phone, nobody really understood what I was talking about. In my business, we treat every patient that walks in the door as infectious. And if we did that for our deer also, I just think we'd get better data. All the facts that we're not getting data now because we're checking our deer in on the phone. And we have no way to determine even if the deer we have in our state are CWD positive, unless we just see one that's frothing into the mouth and staggering around, and we call the agency and they come pick it up.
Well, I'll admit, when you first floated the idea in that during the conference call, I thought it was a little crazy at first.
I'm a little crazy.
But now I see the value, and I appreciate you suggesting that, because it has merit, and we should continue to explore it.
In my opinion, even if we go and close down every state around us, we still have to have a means we need to, at least in our in-state deer, have that incentive program for our meat processors and our taxidermists, so that we have some way of collecting data.
And such a program would complement these options as well, so it would be complementary.
But one way we could do it is just do the 100-mile buffer and then develop that program, and then that way if you bring in a deer to our state, you've got to take it to a taxidermy processor if you don't debone it, and then that way we're getting data from other states also.
One anomaly, though, is the option D, which is the buffer, is that I don't think a certification program like that would work with that option because of the fact that it would only be required. Well, I take that back. It would
Because you could still-
in non-positive states.
You could still set it up to where even in the buffer, if you bring one into the states, you could need to take it to a processor or a taxidermist.
So let me touch on one other thing real quick. The question about has a carcass ever been the smoking gun in a state? That's the way I define it anyway, is a smoking gun. I can't show you a document that says with absolute certainty that that happened. However, there are two cases, one in New York and one in Michigan, where it appears that was how the prions made it to that area, that it was found. In New York, it involved a captive facility who was also a wildlife rehabilitator and a reputable taxidermist. And through his business practice, the fawns that he was rehabbing were exposed to deer or elk carcasses from Wyoming and Colorado, and then there was an eventual detection in that area. So there's a lot of indications there that a carcass, led to that, but it's not definitive. And then in the Michigan example, there was a CWD found in an area where there wasn't a captive facility nearby, and there's a well-known deer dump in that area, and a lot of the folks there in Michigan travel out of state to hunt, like in Wisconsin, where CWD is a really big issue. So just to touch on that question as well.
I've got a request for a 10-minute break. We'll start right now. Please come back in 10 minutes.